Now, the South African Human Rights Commission has visited the Rahima Moosa Mother and Child Hospital on a fact-finding mission. This follows the controversial suspension of Dr. Tim de Maayer, who blew the whistle on the atrocious conditions at the Johannesburg hospital. The only paediatric gastro-enterologist at the hospital was suspended last week after penning a scathing open letter to the Gauteng Department of Health, complaining about water shortages, power cuts leading to deaths of infants. Dr. de Maayer was reinstated following a meeting between the Gauteng Health MEC, Dr. Nomathemba Mokgethi, and the management of Rahima Moosa Mother and Child Hospital. Advocate Buang joins us now, who's the manager for the Gauteng Human Rights Commission, to share his views on what they found. Advocate, good evening, and thank you very much for your time in joining us today here on In Focus. Firstly, what do you make of the suspension of Dr. de Maayer? Well, now we know he's been reinstated, but it had to take, I suppose, the backlash from society and from doctors, even the provincial department, I beg your pardon, intervening for this particular suspension to be revoked.
Well, the Commission issued a statement on Friday in which we state categorically that we do not support the steps that were taken. We are of the view that Dr. de Maayer acted in good faith and in the public interest, and public interest supersedes the duty of loyalty between the employer and the employee, and the department had to engage with the content of the issues he was raising on behalf of other professional staff at the hospital.
And why does it take the efforts of public health officials for these things to be unearthed?
Well, there is a culture of resistance to transparency and accountability in some organs of the state. And there has been little recourse for those who have decided to speak out, those who have decided to blow the whistle on serious malpractice, corruption, fraud. And that is why the Commission has, over the last 18 months, focused on the important issue of whistleblowers. Because as we speak at the moment in South Africa, we do not have adequate protections for whistleblowers. There is a need for a whistleblower protection legislation in the country which will assist us in unearthing wrongdoing and ensuring that those who stick out their necks are protected and are not victimized and do not lose their jobs as a result of raising issues that may affect the public, because for us the overriding public interest dictates that the public must be informed of any wrongdoing in the public service, even in the private sector, for as long as it threatens the lives of patients or of the public. And at Rahima Moosa, this is a hospital that provides services to a largely poor community, and they provide services to vulnerable persons. And it is important that when issues such as these are raised, that the department does something about it. We visited this hospital in 2018. At the time, there was an outbreak of a bacterial infection. There were severe staff shortages. There were still issues of lack of equipment. And it is disheartening that 3 years later, the very same issues have not been adequately addressed. And we are intending in due course to meet with the new head of department, Dr. Noluchungu, to look at all these historical challenges that have beset this department.
Yeah.
One thing that concerns us is the process that was followed in suspending Dr. de Maayer, which to us appears to have been an attempt to silence the staff at the hospital.
Yeah.
He was the spokesperson. He was echoing the sentiments of his colleagues and decided to stick out his neck in the public interest, and he should be commended. And we want to use this case to make a case for why there will be a need in the foreseeable future for whistleblower protection legislation, and for government to see whistleblowing as a key tool in enhancing accountability, clean governance, that is much needed in the Department of Health, which has had its own challenges of corruption, challenges of maladministration, and leadership instability. And the healthcare system in Gauteng, as we speak, is overloaded. This hospital has had overcrowding challenges, and the fire that gutted Charlotte Mokgethi has worsened this situation, and there is a need for urgent action, and that is why we will be engaging with the Department of Health with the hope that they will heed our call to reclassify Rahima Moosa Mother and Child Hospital as a tertiary hospital. At the moment, it is classified as a regional hospital, and this comes with a number of implications. The implication is that they do not get sufficient budgetary allocations.
Yeah. Before we get to that classification,
in some of their historical challenges.
Assist me here in terms of the conditions at this particular hospital. Dr. de Maayer had initially, for example, complained about cold neonatal wards whose incubators went off. He complained about, for example, scans that are broken, scans that have been stolen and not replaced, toilets that have got no lids. Their blood test results, for example, not coming back on time, and so forth and so on. Are these things that you're saying you still found being prevalent at the hospital?
Yes, the purpose of our visit was to confirm if there is correctness to these allegations, and if the hospital accepts that the issues that he raises are valid. The hospital CEO and the hospital management did acknowledge that there are challenges. Lack of equipment, lack of maintenance of infrastructure, water shortages, power interruptions which affect provision of services at the hospital. So they now have a CEO who was appointed in 2021, and they are trying to attend to all these challenges. They have met with the team from Randwater to address water challenges. There are efforts being made to ensure that there is additional reservoir built to provide water to the hospital. They are engaging with City Power and ESCOM on issues relating to electricity and the Department of Infrastructure Development to ensure that they have uninterrupted power supply. The gift of the givers also assisted the hospital in drilling a borehole.
Yeah.
And they are also looking at public-private partnerships when they are overloaded to share the load with Nelson Mandela Hospital and other hospitals in the district.
Advocate Jones, appreciate your time. Out of time completely. Thank you very much for coming on. Gauteng Provincial Manager for the South African Human Rights Commission.